Complete Conversation, A Little Strain, Pulling at the Edges. That is a poem that Roseanne Shollick wrote about dual diagnosis. Dual diagnosis is when somebody suffers from a mental illness and a substance abuse simultaneously. Research has proven that drugs and alcohol can worsen the mental illness. My name is Sabrina Morgan. I am a student at Post University. I am majoring in human services. I myself suffer from dual diagnosis. I have suffered from this for years now. I have been diagnosed with bipolar disorder, manic depressive disorder, anxiety, and I can go on and on. I also am a recovering addict since 2010. So I have a lot of experience with this, and hopefully you can let me take a moment of your time and educate you on the factors of dual diagnosis, and maybe you can help yourself if you are suffering from this, or help somebody else in a family member or a friend. According to the National Survey of Drug Use and Health, 45% of the United States is suffering from dual diagnosis. That is a lot of people. And so it's important to make ourselves aware of this illness. NAMI.org in 2017, mental health, the development of dual diagnosis can lead to a cycle of self-destruction. The danger of addiction occurs when there is a substance abuse and a mental illness together. Dual diagnosis comes in many forms. It can be any form of mental illness and drug combination, anxiety, depression, bipolar disorder, and countless others. Then combined with alcohol and various drugs. It could even be a sex addiction, gambling addiction. The Foundation Recovery Network states almost 8.9 million people a year suffer from dual diagnosis, and only 7.4% receive adequate treatment. Dual diagnosis is something that affects the whole family. The family suffers because once this gets worse and worse, you end up harming your family. Scientists believe that the same area of the brain is impacted by mental illness is also affected by substance abuse. They also believe that people have a genetic predisposition to substance abuse may also have a genetic predisposition to mental illness. People often turn to substances to self-medicate. They medicate that uncomfortable feeling like just everyday occurrences. It could be how when we're going through something, the normal person, they go see a counselor or a doctor. Somebody with a dual diagnosis, they reach for a substance to numb that, and that eventually backfires on them, because the more they reach for that substance, the more they want that substance, and then it ultimately leads to addiction. Drugs and alcohol can also damage key areas of the brain that can cause symptoms of mental illness to worsen. 1 out of 4 with a mental illness suffers from substance abuse. The National Institute of Drug Abuse and Advancing Addiction. Drugs worsen the brain. The dangers of addiction are often compounded by untreated illnesses, mental illnesses. The development of dual diagnosis can lead to a cycle of self-destruction, cause suicidal tendencies. Severe depression can cause suicide. PTSD, schizophrenia, I can go on. Multiple surveys found that half of those who have suffered from mental illness will experience a substance abuse disorder and vice versa. Research has found that several therapies can help treat the people with substance abuse and mental disorder. It is essential to treat both together as one. Now that I explained the importance of intervention of treating this disorder and the mental illness and substance abuse, how it affects everybody, the family and the person. The worst thing is just watching someone down and not being able to convince them that they can save themselves by standing up. So ask yourself, will you be there to catch them when they fall? I know I will be. Thank you.